Hi, my name is Dr. Cirecie West-Olatunji, and I am Professor and Director of the Center for Traumatic Stress Research at Xavier University of Louisiana. Today, I will present to you the final intervention in the series of 10 interventions with young children, particularly those who've experienced trauma. Today, we're going to talk about in vivo parent-child observation and feedback. This is probably the most commonly used intervention, particularly when we're working with infants and toddlers. So the first thing you need to do to prepare for this interaction is to have an activity in mind. So you need to think about what kind of activity you want the parent and the child to work on and how that relates to the presenting problem. And then, of course, you need whatever resources are associated with that particular activity. So what you do is you start by directing the parent and the child to engage in the activity and inform them that you'll be providing live feedback. Now that's important for you to talk about because you're probably going to interrupt them. You need to think about that because you don't want to interrupt them too much or too little. So you have to really get your timing together. And then, of course, during session, you want to provide feedback on what's happening, both the problematic behaviors as well as the supportive behaviors. So there is a little bit of positive psychology that's a part of this. And then at the end of the session, you want to debrief both the parent and the child. Don't forget the child. So the purpose of this is to provide safety in the relationship between the caregiver and the child. Second, the therapist allows us to assess the nature of the relationship between the parent and the child. So we're observing to see how well they interact and how the parent provides feedback to the child. Lastly, it offers an opportunity for us to assess and provide corrective feedback to the parent. And sometimes we can even offer feedback on what they're doing that works so that they can be more intentional about that. Some of the benefits, of course, it allows for culture-centered therapy because we're actually learning by watching the parent and the child together. So I want you to be very mindful of that. A lot of times we've been trained and we haven't learned a lot about culture-centered parenting skills. And so we might see a parent do something that's very different from what we've learned about. But I'd say watch, engage, and then perhaps consult with someone who may have knowledge or expertise with that particular cultural or ethnic group. It's mildly directive, so that means that you are going to tell them what activity that they will do together, but then after that, you're going to leave them to do it. It, of course, helps with establishing safety between the parent and the child, and it promotes the development as well as the maintenance of effective parenting skills for the caregiver. Now, there are some challenges to this. So one is that the parent may not have a lot of really effective parenting skills. So you don't want to keep interrupting all the time. So if you notice early on in the interaction that the parent is in need of more direction, then you might want to stop and then schedule a session in which you just provide information and then have the parent to try it out at another time. Another challenge is that you as a therapist might have difficulty selecting an appropriate activity. So I would suggest that you work with a colleague or a peer supervisor or even an early childhood educator who might be able to help you to select an appropriate activity. Finally, you need to have the skill of timing. You need to know when to interrupt and when not to interrupt as the parent and the child are engaged in the activity. Because there is a little bit of timing that's needed, I would recommend that this is level 2, meaning it would be better if you were already independently licensed or an advanced therapist, not a graduate student, and maybe not even someone who has graduated from their program but has not earned independent licensure. A case I'd like to offer you is a case of a 2-year-old white male who was brought in for counseling with his mom, who's a single parent. And the child was asymptomatic. In other words, I didn't see anything readily that indicated that the child had any traumatic experiences. So he appeared to be healthy and developmentally normal for his chronological age. The mom disclosed that they had been homeless this past year and just want to have her son checked out. So what I did was ask them to engage in some dramatic play. I had them to construct, they were using blocks, and I had them to engage in some dramatic play together. I observed them, and then I provided them with some feedback on how they were doing. So most of what I provided was really some positive comments on what the mom was doing that was very effective. She was very relieved. So now that you know how to engage in this, I suggest that you go online and locate some videos of some parent-child interactions. And then as you're watching some of those videos on a sheet of paper, write down some moments that you would interrupt the session and provide feedback to the parent on what it is that they were doing. And then write out what that feedback would be. I would recommend that after you've done that, to contact a colleague and sit down and debrief and talk about it and get some feedback. So I'm very interested in how you would use this particular intervention, as well as all of the 10 interventions. You can email me, give me a phone call, go on our website for more resources, and hit us up on Twitter and Instagram. It's at XULA_CTSR. I am most appreciative to the NYU Digital Studio and Faculty Resource Network for the opportunity to create these 10 intervention videos. Thank you so much, and I look forward to hearing from you. Bye.